right, thank you. So just a little bit about myself. I am Mia. I was raised here in Birmingham, Alabama. Actually trained at the Medical College of Wisconsin for my medical school training, as well as doing my residency in OBGYN at the Medical College of Wisconsin in Milwaukee. I did my undergraduate work at the University of Alabama. I got a master's in practice, just that business part of medicine. So basically what I did was I opened a practice called Me Bella Wellness Center, and there I do gynecology for women and adolescents, and then I do weight loss for men and women, and I do a lot of other aesthetic procedures for men and women. So we're going to talk a little bit about screening and prevention, and I will tie some information in for males as well as females, but of course I'm a little biased because I'm a gynecologist, so I tend to speak a little bit more from the female perspective. Screening and prevention. Some of the major screenings that we all should be getting is we should at least be going to the doctor once a year, right? Once you're 50 years old, you should be having your colonoscopy as frequently as your doctor tells you to. Ladies should be having a mammogram. Actually, the new guidelines are that women should have mammograms starting now at the age of 50 every 2 years. So some people are still getting them once a year. And then, of course, if you have a history of breast cancer or anything like that, or a strong family history, you do what your doctor recommends. For men, prostate screening starting at the age of 40 with a digital prostate exam as well as their PSA studies, okay? So the prostate antigen. And then we're going to talk a lot about obesity because, as many of you know, Alabama is one of the most obese states in the United States of America, and now obesity has become the second most preventable cause of death. The first being smoking, and we're predicting that in the next few years, obesity will actually be number one. And then we're going to talk a lot about wellness so that you know some things that you can do so that you can maintain your health. So again, the breast cancer screening, we talked about clinical breast exams you should get when you go see your gynecologist, as well as when you, or if you see a primary care doctor for your annual gynecology visits, but you should be getting a clinical breast exam. And then some people don't recommend the self-breast exams. I personally teach all of my patients how to do them, especially now since we are finding breast cancer in much younger women, and it's before they're actually screened with mammograms. So I teach starting from my adolescents at 18. I teach them how to do their breast exams, and I recommend that everybody continue to do that. And I recommend doing it laying flat as well as sitting straight up. I recommend that you do it once a month around the same time of the month. If you're no longer having cycles, you can pick a day, the 1st, the 15th, or the 30th. And you're looking for hard lumps that don't move and changes. So the best time to do your first exam is when you go see your doctor and you have one done, you have your mammogram, you know that's what's normal for you, and you can recognize change. So please do your self-breast exams. I would rather my patients overdiagnose than underdiagnose. Cervical cancer screening, that's been the big topic of the century because now they're recommending less cervical cancer screening. As many of you know, cervical cancer is caused by that virus called human papillomavirus. Every woman and man who's ever sexually active will be exposed to that virus at some point. It's quite rampant in the population, but the good news is that you hardly ever hear of anyone in America having cervical cancer because the Pap smear screening prevents cervical cancer. So by having regular screenings, and you find you a provider that you trust and go along and y'all come up with a plan for your screening. Now they're saying every 2 to 3 years, but one thing is for sure, screening does not start before the age of 21. So when my teenagers come in, I let them relax and let them know that if you're under the age of 21, there will be no speculum exams, and we don't have to send cells to pathology. Everything that I need to do for an adolescent, I can do through urine and without an uncomfortable exam. Women over the age of 65 who have a history of negative Pap smears and don't have a history of abnormal Pap smears can actually stop having a Pap smear, but remember, when you go to the gynecologist, that's not the only thing that's being done. Not only are we doing the pap smear to make sure you never get cervical cancer, but we're also feeling the size of the uterus, we're feeling the ovaries, we're looking at the outside, and we're looking at the inside. So even though you may not need a pap smear, you still should see a gynecologist for your pelvic exams once a year. Okay? And women over the age of 30, they're recommending starting every 3 years because we do another screening with that pap smear that tells us whether that woman is HPV positive or negative. If someone's HPV negative, they can have a pap smear every 2 to 3 years. If it's positive, they continue annually, and then starting at the age of 21 up until 30 before we start doing the HPV screening, those ladies should be having pap smears once a year. And everybody understands that the pap smears where we take a sample from the cervix, send it to pathology, it comes back as abnormal or normal. If it's abnormal, it's not a big deal to have an abnormal pap smear. It means that our screening tool is doing its job. And if it's abnormal, we do further testing to make sure that that woman never gets cervical cancer. So I always remind my patients, if I call you back for an abnormal pap smear, it happens. Don't be nervous. Don't lose any sleep. As long as you get your pap smears regularly and follow up after an abnormal pap, you will never get cervical cancer, and that's the goal, okay? We talked about the colorectal screening. Screening rates have increased significantly, but even though some of the screening rates have increased, we're still seeing more cancer. So cervical cancer screening is about at 83%, so that's one of the highest screenings that we're doing, which is why we're not seeing the cervical cancer. And don't forget about your colonoscopies. They're so important because just like the cervical cancer screening with the pap smear prevents cervical cancer, the screening with the colonoscopy prevents colon cancer. Because what happens is when they look inside, if they see polyps, they can remove them before they turn into cancer. Those 7 or 28. I don't want to talk about it. But that encouraged me. And then I had so many patients who would come to me and I would say, well, we could fix this abnormal bleeding if you would just lose some weight. Or we could do this if you would just lose some weight. And they would say, well, Dr. Cowan, how do I lose weight? And I'm sitting up there, overweight. And I didn't know how to tell them to lose weight. So I went to a special training program called the Center for Medical Weight Loss, and it trains physicians on behavior modification and weight loss techniques that they can use for their patients. So I did that, learned a lot, started doing my own programs, and I lost weight along with my patients. So some of the things I recommend that everybody do. What's the most important meal of the day? Don't answer. That's right. And when is breakfast? Thank you. Have you been in one of my talks? I'm just kidding. So breakfast is within 1 hour of waking up. So I always tell my patients, when you first wake up, look at the clock. If you wake up at 6:30, you should have some kind of breakfast by 7:30, okay? The test, I write out an eating plan and I teach them how to eat, making sure they have nice balanced meals with good lean protein, healthy fat, and non-starchy carbohydrates. I teach them how to count their calories, how to look up their calories, and how to measure and weigh. I mean, it is a lot of, and most of us have probably done Weight Watchers at some point, and a lot of that stuff gets old, but the bottom line is you don't know how many calories you're eating if you're not measuring, weighing, and journaling. $49, you get your body composition analysis, which is where you stand on my fancy machine that'll tell me your muscle mass, your fat percentage, your water percentage. Muscle and fat percentage would be the the rest and metabolic rate test. That test is $100. And some people will do it on their own, and then I have all kinds of programs that have meal replacements and that don't, or that just focus on calories, or you know what. And so I design a program and customize it to that individual's budget and personality with food.
Can you self-refer?
Yes, and I'm taking new patients. I'll leave y'all all of my information for gynecology, weight loss, and aesthetics. So
Where are you located?
Do you have any handout or a phone number that you
I do. I have, yeah. I have some brochures, and I have some cute little mirrors and cards. So here you go. Yeah.